So I have with me Dr. Wenzhong Xiao, the director of our Computational Research Center for Complex Diseases, to give an update on a project his team worked on that we call the TreatME survey. So this was a survey created and distributed by patient researcher Martha Eckey, which collected information from people with ME/CFS and long COVID about their experiences with these different treatments. Dr. Zhao's team then analyzed the data, which came from almost 4,000 participants and covered over 150 treatments. Dr. Zhao, thanks for coming on to give an update. Could you walk through some of the major findings from your analysis?
Sure, thank you, Danielle. So this is one of the main figures that show the results of the treatments that significantly improved patient conditions as reported by the patients, as well as you can see on the right side, each one of the symptoms that the treatment seemed to help. What we see here are the top 20 treatments as well as the conditions. What we see is that most of the treatments going from fluid and electrolytes down to curcumin seem to help one or two symptoms, but it doesn't seem like that all the treatments help all the symptoms. So what this showed to us is that perhaps patients can consider individual treatments based on the symptoms that they experience. So that's one of the take-home messages that we learned. The second is that some of these treatments have already been recommended by, for example, the clinicians' recommendation in their consensus statements. For example, the fluids and the electrolytes, pacing and compression stockings, these are non-pharmaceutical treatments that perhaps patients can consider. Following that, we see the treatments like histamines and other select mast cell activation treatments that are also among the top treatments. As we know, these are the treatments for mast cell activations. There are a few other treatments that are also well recognized in this field. For example, we get the low-dose nitazoxanide and mestinon. Both are under clinical trial here in Boston. In addition, we see a few other type of treatments that are potentially worthwhile for follow-up clinical investigations. And this include the nattokinase and lumbar kinase, as well as the anticoagulants, the ADHD stimulants, as well as this maraviroc, which is a CCR5 inhibitor that might be worthwhile for further investigation. Vitamin C is used as a control in this case, and as many patients know, graded exercise therapy was reported as the most negative impacting patients' conditions.
Yeah, this is great. Thank you. So just kind of, looking at the figure as a whole, maybe we can say the more orange you see, the better response there was, and the more blue, the worse response. Is that, kind of a good way to look at the colors here?
Yeah, very good point. Patients' response included 7 levels from much better, which the deepest orange color, to much worse, which is the darkest blue color. And I think you raised a good point that, some of these treatments seem to have a higher level of either much better or modest better. And, for patients as well as the clinicians to consider the treatments, that might be another consideration. One of the other consideration from this result is that some of the types of treatments, for example, ADHD stimulants, seem to have a higher percentage of the blue colored response, which means that side effects. In fact, we find that at least 20% of the patients would have a negative response to drugs like ADHD stimulants, as well as other treatments that affect their central nervous system. So I think that's one of the considerations for potentially selecting drugs that affect their central nervous system.
So I think this really, highlights some of the heterogeneous nature of these patient populations, right? We're seeing obviously different people responding differently to the same drug or supplement or whatever the treatment may be in this case. And in some cases, even looking on the right side with the darker green showing, I think more patients saying that that particular treatment helped that symptom. Is that what the darker green means in this case?
Yes,
Yeah. So I think,
exactly.
it really kind of highlights just, how different treatment strategies need to be used for different people depending on how they present clinically. And I think you kind of dived a little bit into this with some of this data in this project too. Can you talk a little bit about some of the subtyping that you did with this work?
Yeah, excellent question. So one of the potential insight that we get from this result is that exactly as said, the response from the patient seems to be quite diverse. So naturally, we're thinking that whether we can actually utilize the symptoms as well as the comorbidities of the patients to try to predict, what might be causing the different type of response to the same drug among the patients. So what we did was that, as you can see from this figure, the left side was the patient symptoms and on the top part, and the patient comorbidities on bottom part. And we just clustered the patients based on their symptoms and the comorbidities. And they seem to fall into 4 groups. As you can see here, the numbers in each entry shows the percentage of patients within that cluster that have that symptom. For example, the leftmost cluster is patients that seems to have most symptoms. As you can see, the color seems to be darker compared to the other 3 clusters. And the rightmost cluster seems to be most lighter. That means that the percentage of patients that have that set of symptoms seems to be the least. And then we get this second cluster, which are dominated by a significant number of patients that have this comorbidity of POTS. And the third cluster seems to have patients without, much POTS, but, higher percentage of brain fog and pains. I have to say that this separation seemed to be also consistent with the ME/CFS criteria set by the Institute of Medicine, where you do have a subset of patients that have mostly POTS-related symptoms, and the other set seem to have problems with brain fog. So we then looked at the treatment outcomes within each cluster, and that's shown on the right side. So again, the numbers that higher shows that higher percentage of patients within that cluster would show a positive response. And what we can see here is that, for example, for patients who have most of the symptoms, some of these treatments like, IVIG, for example, or manual lymphatic drainage seem to be reported as, more helpful than some of the other clusters. While for the second cluster, where POTS is a dominant symptom, you would get some of these other treatments, for example, low-dose naltrexone and mastinol, to be more effective, comparing to, for example, the third cluster, where there's no POTS, but for the third symptom, third cluster, as we know, brain fog and pain seems to be more dominant. And then in that cluster, you get ADHD stimulants that seems to be more effective in that subcluster of patients comparing to all the other three clusters. So I hope that following these lines of research, we can eventually figure out, what type of patients might benefit from what type of treatments. Obviously, this is a part of our ongoing analysis. And I hope next time when we talk, we can have some more information for us to share with the patient community.
Excellent. Thank you so much for providing this update, Dr. Xiao. I really appreciate your time.
Sure. Thank you.